Hello, I'm Dr. Michael Rothkopf, Medical Director for RxNutrition. I'm a clinical professor of medicine at Rutgers, New Jersey Medical School, and a past president of the National Board of Physician Nutrition Specialists. Our organization consists of physicians who have dedicated themselves to utilizing clinical nutrition in their medical practices. RxNutrition is an e-learning platform intended to provide nutrition knowledge for physicians in clinical practice. We realized that we did not get much nutrition education in either medical school or residency. So we've developed this platform with the help of a wide variety of experts in the field to give you the basics to utilize nutrition in your clinical practice, whether it's in the outpatient setting, the hospital, or the ICU. What you're about to see is an introduction to our first module, Critical Care Nutrition. If you like what you see and you're interested in learning more about how to apply nutrition knowledge to your clinical practice, visit our website and sign up for our course. If you do that, you'll be able to get CME credit for the work you do in taking our course and sign up for subsequent modules. I hope you enjoy learning about clinical nutrition. It's been a major part of my life, major part of my practice. There are so many patients who need attention to their nutritional status when they have developed a medical illness. But more important than that, there are nutritional components to practically every disease. And if we don't look at this carefully, we're really leaving a lot of information and potential for helping patients off the table. The goal here is to really introduce and utilize what's available in nutrition science for the care of all the patients. Good luck.
Critically ill patients with moderate to severe nutrition risk may benefit from early enteral nutrition or may be harmed by ongoing iatrogenic underfeeding. In these patients, the benefit of nutrition therapy likely depends on factors such as route, dosing, timing, content of nutrient substrate, interruptions in delivery, and efforts to promote patient mobility. The value of early enteral nutrition is supported by mechanistic data delineating its physiologic effects, which provide both non-nutritional and nutritional benefits to the critically ill patient, maintaining gut barrier defenses and supporting the commensal microbiota. Initiating enteral nutrition early after admission to the ICU is important, ramping up slowly to provide high-dose protein and moderate doses of energy while monitoring the patient for tolerance and evidence of refeeding syndrome. Parenteral nutrition should be reserved for the high-risk ICU patient who has a relative or absolute contraindication to early enteral nutrition. Some of the key points to remember are: the value of nutritional therapy in critical illness is based on the physiologic response to early enteral nutrition. Early enteral nutrition reduces infection and mortality compared to when therapy is delayed or withheld. Maintaining gut defenses while supporting the commensal microbiome favorably alters the response to critical illness. Feeds should be advanced slowly to avoid refeeding syndrome and assure tolerance in the prescribed regimen. You will see how all these play out in the case we are about to discuss. At the end of this activity, you will be able to describe the physiologic response to enteral feeding and its value on patient outcome, explain the consequences of overly aggressive nutrition therapy early in critical illness, describe how to monitor the ICU patient on EN through the phases of critical illness. In the case you are about to see, you will be faced with a patient who is severely ill in a medical ICU. While the medical management of such patients is critical, in this case we will focus on the nutritional needs of the patient and how best to manage their feeding in support of their recovery. Let's meet the patient now.